Clinical Assessment and Intervention of Social Anxiety Disorder by Whitney Greene, Social Work Department, King University, Psychopathology and Assessment, Professor Denise Anderson, June 15, 2025. According to the National Institute of Mental Health, 2022, social anxiety disorder is a common anxiety disorder. A person with social anxiety disorder feels symptoms of anxiety or fear in situations where they may be scrutinized, evaluated, or judged by others, such as speaking in public, meeting new people, dating, being on a job interview, answering a question in class, or having to talk to a cashier in a store. Doing everyday things such as eating or drinking in front of others or using a public restroom also may cause anxiety or fear due to concerns about being humiliated, judged, and rejected. Social anxiety instills fear. For some, they cannot function in a social setting and it interferes with their day-to-day life. Gray and Zai 2016 found that when making the competency-based assessment, it should not surprise a practitioner to discover interpersonal problems in a client's life, such as problems sustaining employment, suspended educational pursuits, lack of career promotion, and severe social restrictions. According to the National Institute of Mental Health 2022, social anxiety disorder usually starts during late childhood and may resemble extreme shyness or avoidance of situations or social interactions. It occurs more frequently in females than in males, and this gender difference is more pronounced in adolescents and young adults. Without treatment, social anxiety disorder can last for many years or even a lifetime. In this presentation, I hope to educate you on identifying conditions of the disorder, prevalence rates, the impact on social functioning, the theory of etiology, interventions, and community resources of social anxiety disorder. The diagnostic criteria for social anxiety disorder F40.10. Criterion A is a marked fear or anxiety about one or more social situations in which the individual is exposed to possible scrutiny by others. Examples include social interactions, having a conversation, meeting unfamiliar people, being observed, such as eating or drinking, and performing in front of others, such as giving a speech. Note, in children, the anxiety must occur in peer settings and not just during your interactions with adults. Criterion B is the individual fears that he or she will act in a way or show anxiety symptoms that will be negatively evaluated, such as will be humiliating or embarrassing, will lead to rejection, or offend others. Criterion C. The social situations almost always provoke fear or anxiety. Note, in children, the fear or anxiety may be expressed by crying, tantrums, freezing, clinging, shrinking, or failing to speak in social situations. Criterion D. The social situations are avoided or endured with intense fear or anxiety. Criterion E. The fear or anxiety is out of proportion to the actual threat posed by the social situation and to the socio-cultural context. Criterion F. The fear, anxiety, or avoidance is persistent, typically lasting for 6 months or more. Criterion G. The fear, anxiety, or avoidance causes clinically significant distress or impairment in social, occupational, or other important areas of functioning. Criterion H. The fear, anxiety, or avoidance is non-attributable to the physiological effects of a substance, such as drug of abuse, a medication, or another medical condition. Criterion I. The fear, anxiety, or avoidance is not better explained by the symptoms of another mental disorder, such as panic disorder, body dysmorphic disorder, or autism spectrum disorder. Criterion G. If another medical condition, such as Parkinson's disease, obesity, disfigurement from burns or injury is present, the fear, anxiety, or avoidance is clearly unrelated or is excessive. Specify if performance only, if the fear is restricted to speaking or performing in public. American Psychiatric Association, 2022, pages 229 and 230. The differential diagnoses that I chose is autism spectrum disorder and separation anxiety disorder. On these slides, you will see the similarities of social anxiety disorder. So autism spectrum disorder is similar by difficulty with social interactions, avoidance of social situations, social withdrawing or discomfort in group settings. Separation anxiety disorder is similar because anxiety related to being in a certain situation, such as school and social events, avoidance behaviors, and clinginess or fear of being alone. So the process of differential diagnosis involves carefully evaluating a client's symptoms and ruling out other mental health or medical conditions that may be present. This helps ensure that the client receives the correct diagnosis and treatment plan. The process of differential diagnosis involves a comprehensive clinical interview that gathers a detailed history, including symptom onset, duration, severity, and specific triggers such as like speaking in public and meeting new people. A social worker should also utilize the diagnostic criteria in the DSM-5TR for social anxiety disorder to include a marked fear of social or performance situations where the person is exposed to possible scrutiny by others lasting for 6 months or more. Standardized screening tools can help quantify symptoms. The social worker will then evaluate for overlapping symptoms with other mental health disorders to rule out differential diagnoses. According to Guy Evans, 2023, social anxiety is driven by fear of negative evaluation. A person is afraid of being judged or embarrassed in social settings. Autism, on the other hand, is neurologically based. An autistic person's social difficulties come from differences in social understanding and sensory processing, not from fear of judgment. To distinguish between social anxiety disorder and autism spectrum disorder, I will need to utilize the DSM-5TR to understand that anxiety or autism spectrum disorder symptoms appear in early development and are more pervasive. Individuals with autism spectrum disorder often have repetitive behaviors and restricted interests, which are not features of social anxiety disorder. Also, social discomfort in autism spectrum disorder is usually due to difficulty understanding social cues and not fear of negative judgment. According to Gray and Zide 2016, separation anxiety is seen in children between 18 months and 3 years of age, or stranger anxiety, which is typically seen at 7 to 11 months of age. Being able to differentiate between normal age-appropriate behavior and the symptoms of social anxiety disorder underscores the social worker's skill in collecting, organizing, and interpreting client data. Typically, separation anxiety disorder is seen when a child is attached to a parent or caregiver and may avoid social settings. Individuals with separation anxiety disorder are usually comfortable in social settings when their attachment figure is present or when they are at home, whereas those with social anxiety disorder may be uncomfortable when social situations occur at home or in the presence of attachment figures. American Psychiatric Association, 2022. So to distinguish these disorders, I would need to use detailed developmental histories, the DSM-5TR diagnostic criteria, and contextual understanding of the client's fears and behaviors. Social anxiety involves fear of judgment. Autism spectrum disorder involves difficulty understanding social situations. And separation anxiety is centered around distress from being away from loved ones. Prevalence rates by gender and race ethnicity. Social anxiety disorder tends to affect men and women differently, with research showing it's more common in women. According to Hoffman et al. 2010, the disorder was more prevalent in women, showing 50.7% than in men, showing 35.6%, and more prevalent in ethnic. This pattern is seen around the world, with women often experiencing social anxiety more than men. This could be due to a mix of biological differences and the way women are raised to be more aware of how others see and judge them. According to Hoffman et al. 2010, the differences in how social anxiety affects men and women show up across many cultures, suggesting that these gender patterns are fairly consistent worldwide. The prevalence of social anxiety disorder also varies significantly across racial and ethnic groups. According to the 2001-2002 National Epidemiologic Survey on Alcohol and Related Conditions, being Native American, being young, and having low income increase the risk for developing this disorder, whereas being male, being of Asian, Hispanic, or Black race ethnicity reduce the risk. Hoffman et al. 2010. Furthermore, findings from the National Comorbidity Survey replication revealed that both Black and Hispanic minority groups had lower risk for social anxiety disorder as compared to the non-Hispanic white group, Hoffman et al. 2010. Interestingly, the study found that the lower rate among Hispanics was found among the younger cohort, highlighting how cultural and generational factors intersect with mental health outcomes, Hoffman et al. 2010. These findings suggest that certain cultural or social protective factors may reduce the prevalence of social anxiety disorder in some ethnic groups. So, what are the impacts on social functioning? There's education, there's employment, there's friendship and relationships, and then there's social isolation. So, social anxiety disorder can significantly interfere with a person's ability to function socially. According to Yadavov and Ahmed 2022, educational achievement can be undermined with individuals having a heightened risk of leaving school early and obtaining poor qualifications. Individuals with social anxiety disorder are typically employed. However, they report taking more days off work and being less productive because of their symptoms. Yadav and Ahmed 2022. Individuals with social anxiety disorders have been known to take off from work or quit their jobs if they are in a setting requiring presentations. According to Yadav and Ahmed 2022, individuals with social anxiety disorder have fewer friends, they are less likely to marry, are more likely to divorce, and are less likely to have children. Social anxiety disorder can cause an individual to isolate and avoid activities such as shopping, public events, or even eating out. Then we have the theory of etiology, and that is genetic and familial factors, early learning and parental influences, biological influences, peer relationships in school context, developmental factors, cultural and environmental influences. So the genetic and familial factors. There's substantial evidence that social anxiety disorder has strong familial links. Children of parents with social anxiety disorder have a significantly increased risk of experiencing this disorder, and parents of children with social anxiety disorder are also more likely to experience the problems. These familial links suggest a genetic predisposition through the inherited risk, maybe broader internalizing disorders, not social anxiety disorder specifically, and twin studies show genetic influences is stronger at younger ages. The diagnosis of social anxiety disorder, which requires symptoms to impair daily life, is less heritable than general social anxiety symptoms. This suggests that while social anxiety may be partly genetic, whether it becomes a disabling disorder is more influenced by life experiences. Spence and Rape, 2016. Then there's the early learning and parenting influences. So parenting styles marked by overprotection, criticism, or low warmth may contribute to developing social fears. According to Spence and Rape, 2016, most recent models of child social anxiety disorder posit that parents play an important role in the early development of anxiety in children and maintaining or enhancing behaviorally inhibited temperament. Children may learn to fear social situations through modeling, like watching anxious parents, or negative experiences like social rejection or embarrassment. Social anxiety is linked to how the brain processes fear in social situations, especially involving areas like the amygdala and prefrontal cortex. Very basically, the brain areas implicated in social anxiety are typically those associated with emotional processing of stimuli and activation of the higher cognitive processes involved in emotion regulation and behavioral responding to the stimuli. Spence and Rape, 2016. People with social anxiety disorder often have an overactive amygdala, which makes them more sensitive to social threats and may have trouble regulating emotions due to inconsistent activity in the prefrontal cortex. Research also suggests that teens with social anxiety disorder show heightened responses in brain systems tied to rewards and motivation, which might explain their strong desire for approval but fear of social situations. Spence and Rape, 2016. Then we have the peer relationships and school context. So social anxiety has been seen in situations that occur in school settings, like answering questions, giving presentations. Negative peer experiences such as bullying or exclusion can trigger or worsen social anxiety, and the lack of social skills or poor peer support increases vulnerability. According to Spence and Ray, 2016, there is growing evidence that socially anxious young people perform less well on social tasks than non anxious peers. In turn, poor social performance may then lead to peers to respond less positively towards the anxious child, which leads the anxious young person to expect negative outcomes from future social interactions, perpetrating a vicious cycle. Generally, individuals who struggle with a social anxiety disorder are more likely to experience victimizations by peers. Then we have the developmental factors. So, timing does matter in social anxiety disorders. Risk factors affect children differently depending on their developmental stage, and genetics may play a larger role in earlier life. So, social experiences such as peer acceptance become more influential in adolescence. And then there's the cultural and environmental influences. So, cultural expectations, like high emphasis on performance or social harmony, can shape how social fears develop and are expressed. Environments that are overly evaluative or competitive can intensify social anxiety. According to Spence and Rake 2016, cultural differences might nonetheless affect ways in which social anxiety is expressed and thresholds at which the clinical disorder, social anxiety disorder, is diagnosed. They may also interact with other risk factors for social anxiety by affecting social reactions to withdrawn behavior. Then we have the psychosocial and the psychopharmacological interventions. So, for the psychosocial, cognitive behavioral therapy, exposure therapy, social skills training. For the psychopharmacological, SSRIs, benzodiazepines, and anticonvulsants. So, cognitive behavioral therapy is one of the most common and effective ways to treat social anxiety. It usually involves helping people face the situations they're afraid of, learn how to change unhelpful thoughts, and build confidence through social skills practice. Cognitive behavioral therapy is typically delivered in either group or individual formats and often incorporates relaxation techniques to help manage the physiological symptoms of anxiety. National Collaborating Center for Mental Health 2013. Exposure therapy is a core element of collaborative cognitive behavioral therapy, encouraging individuals to systematically face feared social situations either through role play or real world exercises. These experiences are structured in graded hierarchy from least to most anxiety provoking scenarios to promote habituation and challenge maladaptive beliefs. National Collaborating Center for Mental Health. Social skills training targets deficits in verbal and nonverbal communication based on the premise that social anxiety is partly due to uncertainty about how to behave in social settings. Individuals are taught specific skills such as initiating conversations, giving feedback, or maintaining eye contact. These skills are rehearsed through structured role plays and homework assignments, often resulting in reducing anxiety through increased competence and belief confirmation. National Collaborating Center for Mental Health, 2013. Several pharmacological treatments have shown efficacy in managing symptoms of social anxiety disorder. So the SSRIs are commonly prescribed and work by increasing serotonin concentrations in the brain, thereby improving mood and reducing anxiety symptoms. National Collaborating Center for Mental Health, 2013. Benzodiazepines are another class of medications that enhance the effect of gamma aminobutyric acid, the brain's primary inhibitory neurotransmitter. Although they can be effective in reducing anxiety, their use is typically limited due to the risk of tolerance and dependence when taken over long periods. National Collaborating Center for Mental Health, 2013. Anticonvulsants, particularly alpha 2 delta calcium channel blockers, have also been explored as treatment for social anxiety disorder. These medications reduce neuronal excitability, although their exact mechanism in treating social anxiety remains unclear. They are most commonly used for neuropathic pain. National Collaborating Center for Mental Health, 2013. The side effects of the SSRIs are gastrointestinal symptoms such as nausea, diarrhea, dry mouth, and loss of appetite, central nervous system effects such as headache, dizziness, insomnia, and other effects such as sweating, tremor, weight changes, and in rare cases, bleeding risk. National Collaborating Center for Mental Health 2013. Then we have the community resources. There is the National Alliance on Mental Health Disorders, and they actually have a support group that meets on the second Thursday of the month at 7 p.m. at Harrison Christian Church here in Johnson City. And then there's a Friendship Connection peer support that's in Kingsport that enhances personal, social, and community living skills. And then I found a resource, an online resource for Hate Peer Certified. It's anxiety support chat rooms. So clients can join online and discuss their life journey with others with similar experiences. And the meetings are led by professional peers. So every user can browse, join, or schedule peer support connections. And then cognitive behavioral therapy is an in-person therapy. And you can utilize the www.growtherapy.com that can assist with finding a local therapist that accepts insurance or if they are a cash patient. So, the National Alliance on Mental Health Disorders and the Friendship Connection Peer Support Center and Hey Peer Certified Anxiety Support Chat Room are support groups. Support groups are beneficial whether they are face-to-face or online. Support groups can make a real difference for someone living with social anxiety. Being around others who understand what it feels like to fear social situation helps people feel less alone. These groups offer a space where individuals can share their experiences, listen to others, and slowly build confidence in speaking up. Over time, this kind of safe, low-pressure environment can help people practice social skills, learn from one another, and feel encouraged by the progress others are making. Online groups are beneficial for those who may find in-person meetings too overwhelming at first. Just knowing you're not alone and what you're going through can be incredibly reassuring. Cognitive behavioral therapy helps people with social anxiety by giving them tools to understand and manage their anxious thoughts. It teaches them how to recognize negative thinking. For instance, assuming others are judging them. The individual can replace this thought with more realistic ones. Cognitive behavioral therapy also involves slowly facing feared social situations, which can help build confidence and reduce the urge to avoid them. Over time, many people find they feel more comfortable in social settings and can handle challenges better. It is a practical, hands-on approach that can make a real difference in everyday life. And then my conclusion. Social anxiety disorder is more than just being shy. It is a deep fear of being judged or embarrassed in social situations. Things that may feel normal to others, like speaking in class or ordering food, can feel overwhelming for someone with social anxiety. It usually starts in late childhood and it tends to affect females more than males. If it is not treated, it can last for years and impact someone's ability to go to school, hold a job, or maintain relationships and friendships. Diagnosing social anxiety disorder can be tricky because the symptoms sometimes look like other conditions such as autism or separation anxiety. That is why it is important to gather a full history and look at how long the symptoms have been persisting and what situations make them worse. There is not just one cause of social anxiety, it is a mix of things. Genetics, brain chemistry, parenting style, and experiences with peers like bullying all play a role. Even culture and environment can shape how social anxiety shows up in a person's life. Treatment can make a big difference. Cognitive behavioral therapy helps people understand and challenge their anxious thoughts. Exposure therapy helps them slowly face their fears in a safe, structured way. Social skills training gives them the tools to feel more confident in conversations. Medications like SSRIs can also help manage symptoms. Support groups, whether in person or online, are a way for people to connect with others who understand what they are going through. These groups can help reduce feelings of isolation and offer encouragement and practical advice. Thank you for listening to my presentation. I hope you enjoyed it.